What's going on, everybody? Welcome to my channel, Cavity Free Kids. I'm Dr. Adi, a pediatric dentist. I made this channel because I want to share advice and tips that I've learned over the course of the last 12 years to help you keep your kids out of the dental chair. So the first topic that I'm going to cover in this first video is a phrase that I hear very often from parents, which is, aren't they just baby teeth? I still hear this every year, and I think that the reason parents say this phrase, they think that because baby teeth fall out, that there's no cause for concern if they become decayed or infected. The truth of the matter is that it matters very much what happens to baby teeth, and I'm going to explain why in this video. So you're going to learn why baby teeth matter more than you might think, why no pain doesn't mean no problem, how infections spread to adult teeth, the hidden orthodontic costs of damaged baby teeth, and also how baby teeth shape speech and confidence. So the reason I know a lot about this topic, as I mentioned already, is that I've been a pediatric dentist since 2012, and I've treated thousands of kids across in many different settings, dental clinics, treated kids with sedation, without sedation, and I've seen the whole gamut of problems that kids experience with their teeth. So everything I teach parents in my office, I'm going to share with you on this channel. So I actually had a mom recently that brought her 5-year-old in with pain and swelling. She said she noticed a cavity but didn't think it was serious and said this phrase, they're just baby teeth, right? And that's what kind of inspired me to finally sit down and record this video. The infection in this case had already reached the developing adult tooth underneath, so the kid needed emergency treatment and antibiotics, and in the future will possibly need orthodontic work because he lost the tooth early. So we'll just go over some of the key helpful points here. The baby teeth that your kid has in their mouth some of them are going to stay in the mouth until your child is 10 to 12 years old. The second, baby molars, some kids even have as late as 13. So, if you've got a 5-year-old with untreated dental decay, you're looking at a situation where those teeth might be in the mouth for another decade. So yes, they are just baby teeth, but they're not going anywhere in most cases for a while. The front teeth, the incisors and the canines, yes, the kids lose a little bit earlier, but still not until, most kids don't start losing their teeth until they're 6 years old, 7 years old in some cases. So another thing to keep in mind is that cavities grow very quickly in kids, more quickly than in the adult dentition. So untreated decay can progress alarmingly fast. So it's very important to treat it. Untreated pain or untreated decay rather equals pain, infection, and costly procedures. So as I mentioned before, infected baby teeth can damage adult teeth beneath them. So yes, they are going to fall out eventually, but not before shaping everything about your kid's smile. No pain equals no problem? No, this is not correct. Kids often don't recognize dental pain until it's really severe, and at that point, we're dealing with a more serious issue once the pain has arrived on the scene. The shorter, shallower roots on baby teeth means that any infection that develops underneath the tooth is going to spread more quickly. And so, in one sense, the most dangerous cavities are actually silent because they'll go by unnoticed, for months, years in some cases. And by the time a child complains, the decay is usually advanced. So this is something that's really important to address. A lot of kids don't complain when the problem's small. They complain once it's become unbearable. The next thing that I want to talk about is the successor teeth. These are the teeth that are growing underneath the baby teeth that are making their way through the bone up towards the surface while the baby teeth are in the child's mouth. They're developing just millimeters underneath the baby teeth. So an infection from a baby tooth can not only damage the enamel of the permanent teeth, but also discolor future adult teeth. They can grow in with pits and enamel deformities, which will need treatment in the future. You're not treating baby teeth, it increases the risk of cosmetic treatment that might be necessary on permanent teeth. I've seen permanent teeth come in with cavities, which is pretty crazy. A lot of parents don't realize that this can happen, but it definitely can. So a cavity on a baby tooth can literally leave a scar on the adult tooth beneath it. Next thing I want to address is baby teeth and orthodontics. So baby teeth are natural space maintainers. When a child loses a baby tooth early, that space is going to now form, or the teeth surrounding that space are now going to kind of shift into that space. The bone is going to change. The soft tissue in that area is going to change. So early loss of baby teeth is going to cause some shifting. Even with remedies like space maintainers and things like that, you're still going to have some malformation of the space that is existing in the arch. So issues with baby teeth can cause crossbites, overcrowding in the future, impaction as an adult tooth that isn't growing in the direction and the position that it's supposed to. And this can cost, in some cases, it can cost you thousands of dollars in orthodontic treatment in the future. So when a baby tooth's lost too early, the mouth kind of collapses inward. You might be looking at braces in a situation where you wouldn't have otherwise. So really important to take care of baby teeth for orthodontic reasons as well. And then the last thing that I want to talk about is speech, nutrition, and confidence. So the front teeth of a child guide speech sounds, the, f, the f sound and s sounds. So missing teeth can cause lisping and articulation issues. This is something that can affect a child's confidence, especially if they're school age. Nutrition, on the nutrition side, healthy molars allow children to properly chew their food, which is going to lead to better digestion. Nutrition begins in the mouth. So a child that can chew their food up properly is going to have better nutrient absorption in their gut. Super important to retain the molars as long as possible. And just in general, healthy teeth support confidence at school and socially. So we want to teach our children to take care of their teeth, give them the confidence of a healthy smile. Baby teeth also maintain facial structure and growth patterns. So it's not just, losing a tooth doesn't just mean that you've lost that tooth. It also affects, everything's interconnected in the mouth. Your child's facial structure can actually change if they're losing teeth earlier than they're supposed to. So, the teeth shape more than a smile. It shapes their voice, their confidence, and their growth. The truth is, baby teeth, they're not really practice teeth. They're the foundation for everything that comes afterwards. Taking care of them now saves your child pain, protects their future adult teeth, and prevents costly dental or orthodontic work down the line. I think we'll wrap it up here for this video. Everything I teach parents in my office I've compiled into this ebook that I put in my bio in the video description. It covers brushing, flossing, diet, safe snacks, and the exact routines I use at home with my own kids, and you can check that out in the channel description. I'll see you guys in the next one.